Hello, everyone. I'm Alexa Cortez, and the drug that I will be discussing is cocaine. So, what is cocaine? Cocaine is produced from the leaves of the coca plant, and it is a powerful euphoria-producing addictive stimulant drug classified as a Schedule II drug, which means that it has high potential for abuse but can be administered by a doctor for legitimate medical uses, such as local anesthesia for some eye, ear, and throat surgeries. As we can see right here at the first picture, those are the leaves, and then the bottom is the coca paste, which is produced in laboratories, and it contains 80% of cocaine. And then some street names include blow, coca, coke, crank, flake, rock, snow, soda cop, white powder, snow white, and there are many more, but these are just a few. Now, moving on to the history of cocaine. Cocaine has been used for thousands of years, and it can be classified into three different eras. The first era dates back to 2500 BC, in which South American natives from Colombia, Peru, and Bolivia used it as a medicine and stimulant, mostly through chewing the coca leaves. And it is important to note that these South American civilizations do not show any indication of social problems due to their use of cocaine. And then, as we can see in the first picture, what they have in the middle are the coca leaves, and they typically chew them. As for the second era, this began in the 19th century where North Americans and Europeans began to experiment with the cocaine. The chemist Angelo Mariani identified cocaine during this time, and it was added to cough drops, wine, Coca-Cola. In fact, the picture in the bottom is an ad from a cocaine-laced wine, which was very popular during that time. And also during this time, they were discovering the numbing effects of cocaine. And in the third era, around the early 1980s, it was viewed as a glamorous substance and portrayed as the drug of celebrities, but this didn't last very long, because in the mid 1980s, everyone was using cocaine, so it wasn't seen as glamorous anymore. And there are different forms of cocaine. As we can see at the top, we have the leaves, the powdered cocaine, and also solid form. As for the methods of administration, forms of administration are important in determining the intensity of cocaine's effects, abuse, liability, and toxicity. Oral administration of cocaine consists of chewing of the leaves, as I mentioned, which is not all too common here in the United States, but this produces the least potent effects. Then we have the intranasally administration, which is the snorting of the cocaine, and this gets pushed into the bloodstream through the nasal tissues. Dissolving cocaine in water and injecting it releases the drug directly into the bloodstream, and this heightens the intensity of its effects. Another form is freebasing the cocaine and preparing it to be smoked or inhaled. The effects of smoked cocaine are just as or even more intense than the intravenous administration due to the drug passing rapidly through the lining of the lungs. As for the effects on the body and mind, we have the CNS effects, which is the rush and the high. And the rush is associated with elevated heart rates, sweating, and feelings of speeding or being out of control. The high includes feelings of euphoria, self-confidence, well-being, and sociability. And the peak of the drug, the high, tends to be about 3 minutes after use. And the drug craving occurs rapidly as soon as 12 minutes after administration. And as we can see, this really shows how addictive cocaine can be. And some other include headaches, loss of consciousness, death. Some short-term effects are constricted blood vessels, dilated pupils, increased body temperature, heart rate, and blood pressure. Large amounts can lead to bizarre, erratic, and violent behavior. And then, as you can see, some long-term effects are addiction, irritability, and mood disturbances, restlessness, paranoia, auditory hallucinations. Of course, using cocaine can vary from a few of these effects to most. It's different from person to person. As for potential risk, cocaine psychosis, which is as right here at the bottom, I just want to touch on that. You guys can read the rest, is losing touch with reality and loss of interest in friends, families, sports, hobbies, and other activities. All the individual can really think of is their next use. As for the consequences of cocaine, we have the psychological ones, which can be high chronic doses that alter personality, and then they cause psychotic behavior, resemble paranoid schizophrenia, and then medical complications are disturbances in the heart rhythm, heart attacks, chest pain, abdominal pain, and nausea. And then for treatment, it can be difficult due to the polydrug use. Most cocaine users are not just using cocaine, they are sometimes using more than one drug, which is why the treatment can be difficult. And then there are positives and negatives to the outpatient versus inpatient approaches. For outpatient, it would be positive if the environment was suitable for the recovering addict. Let's say that they have a supportive system of family and friends, then it would be best. But if they don't, then inpatient treatment would be best for them. And then the individual will need to be willing to stop their use of cocaine in order for the treatment to actually be effective. And then these are the references, and thank you for listening. Hope you enjoyed.